Hello, 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 my magical friends. It's TLC, Tuesday Live Chat, here on my page, Dr. Andy Harper. We are going to talk about heartburn in your dog. And I am so excited about this topic. I think heartburn, my point of view, heartburn is so misunderstood in both our canine and our human world. So we're going to go over some stuff that you may have never heard before and maybe the complete opposite of what you heard from your doctor or your veterinarian. My name, if you're not familiar, I am Dr. Andy Harper. I'm a doctor of chiropractic. I'm a certified animal chiropractor. I am not a vet. This is not vet advice. This is information to empower you to know your animals and to go out and do your own research and go out and have those conversations with your veterinarians about what treatment you are doing, what you would like to do. Is there a treatment? Who knew dogs could get heartburn or acid reflux or GERD? Those are all the names that it's been called. I grew up with my grandfather going, got some heartburn, right? And what did we do for it back in the day? We took, they took some Tums, which is calcium carbonate. Don't give those to your dog. And actually, don't take those. So let's talk about the stomach and what is heartburn. What is acid reflux? What is GERD, which is gastroesophageal reflux disease? Oh, that sounds very, very significant and very, very important. And I did take some notes just to refresh my memory on some of the meds that I have seen our canine friends be prescribed by veterinarians and what they do. So you know what you are choosing when you give a medication or choose a medication with your veterinarian. But let's go back to the stomach. Let's go back to digestion. I don't know how many years these proton pump inhibitors have been on the market, right? Omeprazole, Prilosec, Nexium, they're all different names for the same drug. And what they do is they shut down the pumps that make hydrochloric acid in your stomach. And you require hydrochloric acid to digest your food. And in the stomach, you also have a lot of mucus. Oops, sorry, I bumped the camera. You have a lot of mucus to protect the stomach from that hydrochloric acid. That acid that's in the stomach, it's actually designed to have a pH of around 1, which is very, very acidic. You and your dog, okay? And when you take one of these medications, these proton pump inhibitors, what it's going to do is going to shut off those pumps. So you produce less hydrochloric acid, which in turn takes care of the symptom of heartburn. Easy peasy lemon squeezy, right? And what if the entire thought process is flawed? I'm not saying those medications don't work, and I'm not saying there's not a time and a place for them, but what if the entire thought process is flawed? And it's been flawed from the beginning, what I learned in chiropractic school about people, okay? So, stomach produces acid. That acid digests your food, right? And then that food gets digested and it gets moved along into the intestine. It goes into the duodenum. Okay, that's the process. And what happens when you start getting, let's go back a second. So the thought process with the medication is you have too much acid, that's causing the heartburn. And what if that's where it's flawed? What if from the very beginning you were not making enough acid, you were not producing enough hydrochloric acid, you did not have enough enzymes in your stomach, so your food did not digest properly and it sat there and putrefied? And what if that putrefaction, that rancid foods, actually what is causing the heartburn, the acid reflux? So what happens if you further shut down those pumps? You have a higher pH in that stomach. You don't have the acid being produced, but those medications are also limiting the acid or the putrefaction of the food, so you don't have any symptoms. Also, what happens if you don't have a pH of a 1 in the stomach, right? Digestion starts in the mouth. Peristalsis in the gut starts when you swallow. Like, oh, let's see, it's all connected from the mouth to, let's say the toilet, right? Like, whole process. What if it's all connected, right? Awesome. You're not making enough acid. You're not digesting your food, or you're just overloading the stomach. You're eating too much at a meal, and this can go towards your animal too. Or you're eating too close together and you're never able to empty that stomach completely, or your animal's never able to empty that stomach completely. You're going to have food that's undigested sitting in the stomach, wreaking havoc. Okay, so take that medication, you lower the HCl even more, you raise the pH into the stomach. What happens to the pH of the rest of the gut? Because it's dependent, the plan was to feed off of, no pun intended, that pH of 1 in the stomach. Once that raises, that's going to change the entire pH. Now, can the duodenum do its job? Can its small intestines do its job? Can the large intestines do its job? Can the colon do its job if the pH is off on the entire tract? So how much more havoc are you wreaking down the line by using that medication? Remember, this is information. I'm asking you to take a look at it. I'm asking you to take a look at the possibility that the thought process is flawed. Now, I'm not saying those medications don't work, because they work great. Those symptoms go away. No more heartburn. And the concern with heartburn, with GERD, with acid reflux, is that acid will kind of splash up and start to cause some damage in the esophagus. It will start to eat a hole, an ulcer in the stomach. So there are some complications that are possible. But most people aren't aware of what the mechanism is and what can be occurring in the body if they choose those medications. Have a conversation with your veterinarian. Now, I was reading on the internet and came across probably one of the, let's see, how can I put it, most inappropriate, most incorrect information I have seen across the board concerning heartburn. It was scary. It was bringing up surgeries. It was mentioning that it's more common in puppies. It mentioned different drugs, these prokinetic medications, which are not your proton pump inhibitors. These prokinetic medications are much more potent, and that have a bigger conversation with your veterinarian if that's what you're looking at for your animal. I haven't actually seen them prescribed, but you know, in my chiropractic office, it's not really surprising that I wouldn't see those. But they actually increase stomach emptying, so then you're not even breaking down everything properly. It could result in a whole host of other things. Again, may be required, right? What if there's a time and a place for everything? So this is not right or wrong. This is just information to arm yourself with. Now, this article mentioned puppies, and I'm like, what? I see so many senior dogs with heartburn, with acid reflux. It seems to be an old dog thing. Let's just call it a thing. It doesn't have to be a big thing, it's just thing. So what occurs with age? Just simply, things do not function as optimally as they did or they could. In this reality, they break down. Okay, so as we age, Do you produce less hydrochloric acid? With age, do you produce less enzymes? With age and missing teeth and loss of laryngeal muscle tone, does that compromise digestion? Maybe, right? It's up there, possibly. So with less enzymes, less hydrochloric acid, would it be far-fetched that we are now digesting our food not as well as we used to? And so we're getting some of that putrid food, that food to go rancid in the stomach in these senior guys, that then now we see some more heartburn, some more acid reflux, GERD, whatever you want to call it. I like heartburn, right? The name anyway. So, what are some of the signs and symptoms of if your dog is currently having some of this? Generally, not interested in eating, right? Or not interested in eating as much. I think our senior guys generally don't get going in the morning as quickly. It could be some of that acid reflux, that heartburn in the morning. Maybe not, but just keep an eye on that. A lot of times it's just such an empty stomach. Maybe some bad breath, which is also hard with our senior guys. Is it bad teeth? Is it stomach? If that bad breath kind of comes and goes, that's more stomach than a tooth issue. Okay, so kind of keep that in mind. Some foaming, some drooling. The puking of the bile, right? Just yellow bile. My standard poodle Jax did that his entire life. He was a rotten, I labeled him with as a rotten eater. What changed that for him? He did chronic heartburn, if I could get him to get 2 bites of food, it made his tummy feel better, and then he would eat. He would walk over to the bowl, stare at it, really maybe want to eat, but walk away. So if this sounds like anything that that's going on with your dog, they may be having some heartburn. Little old dogs, some big dogs will shake, like their stomach hurts. It shakes. They don't like it. Sometimes you are seeing what could be like physical pain symptoms. And what's intermixed with this as a chiropractic point of view is a hiatal hernia. Again, it's a misnomer in the vet world that is congenital and cannot be changed. That's one component of hiatal hernias. One, it can be congenital, and that's just when, let me see if I can describe, if I can get this correct. You have a little bit extra space along the esophagus and the intestines kind of pooch up. Symptoms do not correlate to how much intestine is pooching up through that diaphragm. It could be a little bit and the dog could be incapacitated, could be a lot and the dog's like, yeah, my stomach's a little sore. So those two don't correlate. Can be congenital, absolutely. Can be transient, can occur because dog ate dead squirrel and violently vomited, or dog ate half a bottle of Rimadyl and was forced to vomit. Dog had, like mine, a corn cob and had to have surgery. So that's kind of those that I consider transient. Like they can occur. Some dogs, stress can be a component of not necessarily causing, but allowing that hiatal hernia to expose itself. There's actually an adjustment for that. I adjust hiatal hernias every single day in my practice, and we create so much relief for the dog. So and that can play a part into heartburn. We may be seeing a hiatal hernia, but we're going to mislabel it a heartburn. It can go either way. Even if we know we're dealing with heartburn, I always adjust for a hiatal hernia. It's not going to hurt if it's not present. I had a little Vizsla come in. She was so cute. She was a tiny little thing. She was about 1.5 years old. And it was her very first chiropractic adjustment. And I always start with hyoid, muscles of mastication, which are the muscles that help them chew, cranial bones, head stuff. We always start with the head, actually start with teeth adjustments. And we did all that, and she's kind of looking at me like, that's the weirdest thing anybody's done to me in my year and a half in this body, right? And Mom was describing her symptoms. She's a rotten eater. She's very picky. She looks like she wants to eat but doesn't. Occasionally vomits up just bile. Like, check, 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 check. In my world, hiatal hernia. So I get on that side of the left side of the rib cage, and I palpate, and it is so tight and sore. So we adjust for the hiatal hernia. She whips her head around, looks at me, and then scoots closer. She's like, oh, that was awesome. And from that moment on, I could do whatever weird stuff I wanted to. She thoroughly enjoyed her adjustment. And that stomach always relates to C3 in the neck on the right side. It's a pattern that I continually find. I generally just adjust for all of it right off the bat. Now, is that a congenital hiatal hernia? She's only a year and a half. Is it transient? Can we change it, even if it's congenital? Well, I'm sure gonna try, right? Why not? Why not try? So she'll come back and we'll recheck it and we'll readjust it, because we are still dealing with muscle memory and changing that. This was what had plagued my standard poodle Jax for 12 of his 13 and a half years. I learned this adjustment. I came home from class. I adjusted his stomach, and he instantly went and ate his food. 12 years. I'm so sorry, buddy. But when you know better, you do better. Just didn't know it existed. And to the day he passed away, if he'd walk over to the bowl and kind of stare at it and not really, I'd adjust that spot in his abdomen and his neck, and he would put his face in the bowl and eat. It can be magical. So if you're watching this and some of this is ringing true with your dog, find an animal chiropractor in your area and see how they can contribute. There's that specific adjustment. We also, as chiropractors, are checking the entire neurological system. So all the nerves that go to the stomach, we're gonna make sure that rib cage isn't rotated. That could be impinging that. We're gonna make sure those shoulders are moving. We're gonna make sure all those nerve transmissions are working freely and completely, which also could change maybe what's going on. Maybe we have some low back pain and puppy dog's really nervous about it and doesn't like it, and they're all hunched up. Well, is that going to change what kind of digestion we're getting? We have a different physical stance. We're going to get different digestion. Maybe we are and different stuff going on with that. Less motility, so the food's sitting in the stomach a little too long. All of that. Okay, one of my favorite homegrown kind of magical fixes for if you believe, and of course have a conversation with your veterinarian. I'm not sure how well it will go, but they are the authority. Get what information you can out of them. See how that goes. But one of my favorite homegrown contributions is apple cider vinegar. It's the apple cider vinegar in the glass bottle with the fuzzy residue at the bottom. It's called the mother. It's much more expensive. It's not the stuff you clean with. So apple cider vinegar, you want the mother, you want it organic, and it's amazing. Start with an itty bitty bit, half a teaspoon, smaller if you have a little dog, couple drops. And what it's going to do is it's going to balance the yeast. It's going to kill and balance the bacteria. It's going to kill and balance the viruses. It's going to help lower that pH in the stomach. We actually, I know, I'm going to say it, want more acid in that stomach so we can fully digest our food. My dogs in my house get it every single day. The Doberman, who is my indiscriminate eater and my most, I would not call him compromised, but he is my management case. He gets it every single day. He'll lick it straight off the spoon. He's an odd duck. This is spicy. Most are like, really, do I have to eat this? Some are, and I could probably say the most aren't even going to notice, especially if you start really small. And it's going to be a journey because we need to slowly increase the acid in the stomach and slowly help support the stomach, right? And so you're going to start, hello, hi kitty. Samuel is saying hi to everybody. And we're going to slowly increase. Christy's asking, does the mother help with the gastroenteritis, balancing the gut? Yeah, we're going to get it, yes. Simple answer, yes. Because once we get the stomach at the pH that's required, it's going to change the pH all the way down the line. Bugs that can live in a pH of 4 can't live in a pH of 1, so we're going to kill those off. Like, we're going to balance all the bugs. We're going to balance the entire gut. It's a journey. And it's inexpensive, and it's easy. And most dogs will eat it. Start really low, move up as you are following the energy to move up and add more. And see what changes you get in the skin. The other thing I always get is, well, they're on probiotics. Probiotics are for the large intestine. What you're dealing with in the stomach requires digestive enzymes. The liver, the pancreas, the gallbladder, they require digestive enzymes to handle carbohydrates, to handle protein, to handle fats. So that you can add to the stomach, right, to help with the digestion. You can do that in addition to the apple cider vinegar if you need to. Digestive enzymes are expensive and may not be required. If you're kibble fed, most likely they are, because your dog is going to need support with the high carbohydrate load. Kim's asking, do my dogs still need digestive enzymes when fed raw? Maybe. I don't do a lot of digestive enzymes with my dogs. I do a lot with myself. They get apple cider vinegar. That seems to really just kind of keep things going for them. After the Doberman had his foreign body removal surgery, he did get some digestive enzymes for a while. I didn't want the stomach working really hard. I did want to take the burden off of the stomach, right? And help with the digestion, just so that organ can rest while it's healing. He also did take, what is it? Carafate, sulcrafate. So it's not that, and that was just for a short period of time, and what that does is it coats the gut. So you might get that if your dog is having issues with other pain medications like steroids or NSAIDs. Sometimes you'll get a carafate or a sulcrafate, and that's just a coating of the stomach. Do you want to add another med to handle another med? That's just a question you have to look at for yourself, another conversation with your vet. I did choose to do it, right? Time and a place for everything. Because, oh yeah, we had stitches in his stomach. And we needed those stitches to heal up before the stomach had digested the stitches away and possibly didn't keep it closed long enough, right? So this was coating it. It's going to keep the acid from taking out those stitches for a longer period of time. That was the thought process. That made sense for this time and place and what was going on with him. I did not put apple cider vinegar right back in his food. You know, we did take, I don't even know how long, but it, you know, at least as long as he was on those meds, we didn't add that in. I actually wanted a higher pH for a short period of time. So as we were healing up, because we needed those stitches. I needed that incision to heal. That was primary. Secondary, well, how long, right? We don't want the pH to be off too long. But that was my thought process through that. So it goes back to time and a place for everything. For what reason are you taking a medication? How long are you taking this medication for? What else is possible that would minimize the use of it if that's what would work for you in your world, right? But most pet parents don't ask any of these questions, don't think anything of it. They get a medication, they're told they need to give it every day, twice a day for the rest of their dog's life, and they just go, okay. And that's a big part of why I'm here every Tuesday to chat with you is, do you really need to do that their entire life? What else is possible? Can we get the inflammation down for a short period of time? Can we coat the stomach for a short period of time, allow something to heal, and then go back to what was working for him, which was apple cider vinegar in his raw food, and he did amazing, I don't think they asked. I did not volunteer any information. They probably would. Their heads might have popped off if they knew that he came home and had a raw food meal back after his surgery. He had a little bit, like 2 ounces. He normally eats 11. Like, I'm not going to overload that stomach. I'm going to keep it really small. We're going to eat every few hours. So that time and a place, that for what reason am I choosing to do this with my animal? These are the questions I'd really like you to start looking at when having conversations with your vet, so you can start getting more information from them. And what is the target? And most prescription drugs work great. They are designed to handle symptoms and signs and symptoms, or just symptoms, beautifully. So it's never a question that they're not going to work. How long do you need them? Do you need them? Is there something else? What else is possible here? All those questions, right? And one of the big reasons people choose to feed raw, one of the big reasons I choose to feed raw, is there are natural occurring enzymes in the raw food that have not been cooked out or processed out. Hello, dear Autumn. Mwah. Right? So they are present. So the likelihood of requiring more supplementation is less. So I've been looking at this more, and well, I've been looking at it for years, but I find it interesting that people choose kibble. It's easy. And then to make sure that their dog's getting enough, they add in like a joint supplement, they add in a fish oil, they add in this, they add in that if they added all that up, it'd be cheaper to feed raw. And it still would be a little more work. I'm not going to lie to you on that. It will be more work. But there'd be less supplements. And we have been so conditioned in this reality that supplements are a good thing. But what if you could get it all from the diet and you don't have to do supplements? What if supplements in general are still foreign to the body? Are your supplements full of synthetic vitamins? If you have a supplement that lists out A, B, C, D vitamins, generally they are not from a whole food source. They are synthetic, and the body can only partially process them. Autumn's like, I was just thinking about this today. She was thinking about heartburn today. So yeah, we can do the easy, cheap food and add all these supplements, or you could try something else. And it's a journey. Whatever you choose, it's a journey. And if you are requiring to lower a pH, which then in turn is going to affect the rest of the gut, which in turn is going to affect the biome, which in turn is going to reduce the leaky gut and the toxins in the body, this is not going to happen overnight. This is going to be a journey. And it's going to be a journey until, because every animal, every body is different. And you have to start to see what you get. I think that's all I had. The proton pump inhibitors that generally animals do get is omeprazole, which is our Prilosec. So if you do want to Google that, that's what they generally get. And I do know some clients that do have that prescription from the veterinarian in the cabinet, and when their dog is having a really bad day, they'll use one, right? Let's get rid of some of these symptoms. Let's get this dog comfortable. Let's see what we changed in the food. Let's see what we added as a supplement. Let's see, maybe it was the weather. Let's see if they were stressed out about something. But it's not something just given because it's supposed to be given every single day. And I think most medications in the veterinarian world, that's how it's set up, because people are possibly perceived as too stupid to figure out that if their animal needs something one day versus another day. So it's just easier. Again, notice this easy, like everything has to be easy. Kibble's easy, a pill's easy. And everywhere you're taking the easy route, right? And I'm not saying it all has to be hard work. Believe me, I've given up hard work. But where do you want to put your attention? Do you want to put your attention on a really good diet and support them that way? Do you want to put your attention on doing all this the easy way? And, where do you want to go with it? What do you want to look at? What do you do for yourself that you don't choose to do for your animals? Bunch of questions. Anything else? I think I covered everything I wanted to cover. Hopefully that was all clear and concise. Hopefully there was some questions in there to tickle your brains. Maybe look at what you've chosen in the past, what you want to choose in the future, some signs and symptoms of what your dog may be going through, especially if they're in their senior years. Just because you choose something does not mean you will still not have some bad days. I deem it the senior dog roller coaster for a reason, because they do. They ebb and flow. They ebb and flow with storm fronts. They ebb and flow with how they slept that night. They ebb and flow with how they eat. They ebb and flow. It's a roller coaster. I tell people, hang on and enjoy their senior babies, right? Any other questions out there? That was a lot. I hope it was a contribution. My right-hand gal is actually on another call learning some new fancy like social media stuff. I'm like, can you get on that call, because I'm not going to really understand it anyway. And I had to talk to my magical peeps. So here I am. So Keisha is not with us today. Any other further questions? It could be past live chats. It could be what's going on with your animal. It does not have to pertain to what we're talking about here. I will give you a second if you are typing. And I do get pretty excited about, Keisha's like, not Keisha. Christy's like so quiet without Keisha. I know, that's why I thought, I'm like, I better mention why she's not here, because it feels a little lonely without Keisha. But I'm so excited she's going to be learning some new stuff, because she does all that, and I'm like, I don't know. All right. Well, we will get this posted. It'll be in Facebook. We'll get it up on, we have a new website coming, hopefully very, very soon. We're hoping to get all the live chats up there. I know they are going up on my YouTube channel, so we're working on that. It's we in the royal sense that I have other people doing that for me. And all right, I think I'm out. Peace out, peeps. Thank you, my magical friends, for joining me today. I'm so grateful. And if you are catching this in the future and you do have a question, you do have something you want to add, hit the comments. Facebook will let me know, and Keisha does monitor the page. At least she monitors the page, more than I do, and we will do our best to get back with you. So just because you're watching this at a later time does not mean we do not encourage your participation. So yes. All right. I will be back next Tuesday. It wasn't a target, but we did kind of end up with a heart theme for February. So I hope everyone had gloriously wonderful Valentine's Day. I think you probably also got the email from me, and one of the podcasts is why I hate Valentine's Day. So not one of my faves, but I did get a card for my hubby and some chocolate. So hey, chocolate makes anything better. I will be back next week. We're going to talk a little bit about teeth and heart health. So we did end up with a theme this month of all about the heart and all that jazz. Okay, I'm done. I'm out of here. So grateful for all of you, my magical friends. Have a great rest of the morning, night, day, wherever you are in the world. So grateful for you all. Bye-bye.